Welcome back. Well, nobody likes spider veins. When summer comes, many people will still wear long pants just to hide their spider veins. So, what can you do to erase them? Dr. Deborah Manjoney is here from the Wisconsin Vein Center and MediSpa with information on spider veins and how to treat them. Good morning to you, doctor.
Good morning, Tiffany. I hope you're staying well.
I am. Thank you so much for joining us, and you too. Let's talk about this, though, because I feel like now that the weather's getting nicer, we're going outside, we're planting, we're walking, doing things to get out more. We sort of notice our legs when they're revealed this time of year. So, what are
Right.
spider veins?
Spider veins are little tiny veins that are just at the surface of the skin and frequently look like a bruise, or they look like a spider web or even a tree with branches, and they can be red or purple or blue and frequently don't cause any symptoms, but they're just an annoyance because they're so unsightly.
It's true. I've had them, and they do. Like on my leg, they sort of clustered and looked like a bruise. So, who does get them most commonly, and how common are they?
Well, believe it or not, about 50% of the adult population actually does have spider veins. They do occur more frequently in women. Up to 70% of women will have them at some point in their life. They can be related to hormone changes, of pregnancy, or of aging. So there are lots of different reasons that can lead to the formation of spider veins, and it's really not something that we can prevent.
Do they have symptoms like, varicose veins often do? Do spider veins?
Spider veins may have some symptoms. They may be itchy, they may be burning. Most of the time, spider veins do not have any symptoms associated with them, but they really can have some symptoms. In addition, sometimes if they're what we call hypertensive spider veins, which are actually bulging a little bit on the surface, they can be nicked or can spontaneously start to bleed. And it can be pretty difficult for somebody to stop, especially if they're older and they have these spider veins like at their ankles. We have seen people really hemorrhage a lot from those areas.
So that seems like they could be a little dangerous. Are they a medical problem?
They're only a medical problem if somebody does have symptoms and they're the bleeding type. Other than that, it's never considered a medical problem. It's just considered a nuisance, a cosmetic issue. But sometimes it actually can be an indication of an underlying vein problem that should be investigated further.
Well, I thought mine were just ugly. They did make my legs feel a little tired, which I've talked to you about before. So how do we treat them? Because a lot of people, whether they're having a medical problem or they just don't like the way they look, they want to get rid of them.
Absolutely. And so the best way is, first of all, to see somebody who knows about vein disease. These spider veins occur mainly in the legs, but they can occur on other parts of the body, even the face or the arms or the trunk. And so it is important to see somebody who knows about vein disease. And because sometimes even when we're evaluating the ones on the legs that don't have symptoms per se, we notice that where they're located may be indicative of an underlying vein problem. And so we might want to investigate that more with an ultrasound. But other than that, to treat these veins cosmetically, which is the great majority of the time that we're treating spider veins, we use different treatments, and really the gold standard is what is known as sclerotherapy. And sclerotherapy is where we use very, very tiny needles to inject small amounts of a liquid or a foamed agent into the veins to get them to close off spontaneously. And these are FDA-approved products that we use.
So we also saw a laser there just a second ago. Laser is another way that you can treat them too.
That's right. We believe that we get much better results when we're using this little pinpoint laser that we trace the veins on the surface. So we're injuring them from the outside in with a laser. And then we often will also inject a little bit of this sclerotherapy, the medication. So we're then injuring them from the inside, so that the combination of the two tends to lead to a more quicker resolution of these vessels.
I had both sclerotherapy and the laser done when I got rid of mine. I didn't feel any pain. Do you feel other people say that it's painful or not?
No, it's really not very painful at all, a little uncomfortable occasionally. There's no anesthetic required. We use a cooler often when we're doing this, so we're spraying cold air on the area somebody's having it done, because the laser feels kind of like a little bit of a hot pin on the surface of the leg. The injection of the sclerotherapy, I always tell people, is it feels as though you're about to have a needle go into your skin, but it's just that you feel it on the surface, and that's about it. It's more anticipation than anything else. There's really almost no discomfort involved.
I think it's so cool watching the laser because it's like it erases them as it goes
That's
by.
right.
So
That's
is this
right.
permanent? Because you could potentially see some of those results immediately.
You can see some results immediately. Often, though, you're left with like what we call a cat scratch after the laser, where it's a little red line that's a discoloration. And sometimes there's bruising after sclerotherapy. So these do take a while to resolve, 3 to 6 weeks until we see these veins disappear. But it's a process. It's not a one and done type thing because there's so many connections of veins underneath the skin. So we also use a light that we call it transillumination, where we're actually putting a light on the surface of the skin to see a little bit larger vein underneath that may be causing these spider veins, or what we call feeding the spider vein, and that has to be injected as well.
I know we're out of time, but I just want you to quick show, because you've got some products. I know you do
Right.
complimentary consultations virtually right now, but there's some
Yes,
things you
we
can
do.
topically put on to help those spider veins.
Right. To help the spider veins and the bruising from the spider veins, we have Enhance from the Elastin line, and we also have Dermica. And both of these creams have natural products, plant-based products in them, licorice root and other things that really help bruising to disappear much more quickly. So it's a great adjunct. But again, spider vein treatment is a process. It may take 2 or 3 treatments to make these things go away. So the sooner you can get in, the better, that you can get started treatment and really have some results by summertime.
You got to do it now, doctor. Thank you so much for joining us.
Thank you, Tiffany.
You bet. And here's the information so you can contact the Wisconsin Vein Center and MediSpa. They're right on Georgetown Drive in Pewaukee. Again, those virtual consultations are complimentary right now at 262-746-9088 or WIMedispa.com.